Carolyn. I'm the Youth Sexual Health Coordinator with ACWA, the AIDS Committee, and this is the HIV 101. So it's the basics around transmission, prevention, and testing. And really what I'm hoping for is to start a conversation around HIV because people don't really talk about it anymore, which leads us through this whole cycle that ends with stigma and discrimination facing people who are living with HIV. And then people don't really have the right information, or they have really old information, or they feel afraid to ask about HIV because of the stigma. So I'm hoping by breaking that silence, we can also interrupt other points of this cycle. And then looking ahead, get people in for testing, that everybody knows their status, that HIV infection rates go down, that there's positive portrayals of people living with HIV on TV and movies, and in the end, that there's no more cases of HIV or AIDS, because everyone's learning, teaching, and talking about HIV. So what is HIV? Breaking it down, it stands for human immunodeficiency virus. So it only affects humans, it weakens the immune system, and it's a virus, not bacteria and not hereditary. It attacks the CD4 cells, which are like the bosses of the immune system. So they're the ones who organize our immune system's response to illnesses and infection. And it can lead to AIDS if untreated. HIV and AIDS aren't the same thing, but they are connected. AIDS stands for acquired immune deficiency syndrome. So we see those same two words, immune deficiency, meaning that the immune system has gotten severely weakened and more vulnerable. AIDS is considered a stage in HIV infection, and it's marked by opportunistic infections. So these are normally harmless bacteria or viruses, but they take advantage of a weakened immune system in somebody with untreated HIV, and they can cause serious illness. We want to be really deliberate when we're talking about HIV. So throughout the whole presentation, you'll hear me say HIV, and you won't really hear me say AIDS. And that's because pretty much in Canada, that's what we're looking at. If somebody knows their status and they're on treatment, their HIV is really unlikely to progress to AIDS, which is a really positive thing. HIV is transmitted in a couple specific ways. Firstly, we need a fluid that contains HIV, and there are only 5 fluids in the body that contain enough HIV to be transmitted from one person to another. So first is blood, next are semen, including pre-ejaculate fluid or pre-cum, vaginal fluids, rectal fluid, and breast milk. And then we need those fluids into a person's body, either coming in contact with the mucous membrane, so like the wet skin linings of the body, so the throat, the foreskin, the urethra, the vagina, the anus, and the rectum, or direct contact with the bloodstream. So some of those activities that facilitate entry into the body are condomless sex, anal, vaginal, and oral, and those are in order in terms of risk. So anal being the highest for either partner, vaginal sex, and then oral sex, which is considered lower risk, but is still a risk. Because if you think about it, sometimes you can get a cut in your mouth if you brush or floss, or maybe there's a sore or a canker in your mouth, and that's direct access to the bloodstream. Also from sharing used needles and equipment, and this could be for drug use or for piercing or tattooing, anything that's come into contact with another person's blood and then hasn't been sterilized and then being introduced to another person's bloodstream. And these are the 2 most common ways that HIV is transmitted in Canada. Also, still a factor, although less so in Canada, is vertical transmission. And this is what we call transmission that happens from mother to child, either during pregnancy, during delivery, when the baby is exposed to the blood and cervical fluid, or during breastfeeding, because breast milk is one of those fluids that can transmit HIV. But we've come a long way in medications, and if a person who's pregnant knows their status, is on medication, and they have a plan with their doctor, it's less than 1% chance likely that the baby will be born HIV positive, which is really good news. So to recap, HIV is not transmitted by kissing or hugging, holding hands, coughing, sneezing, cuddling or snuggling, sharing food or utensils, sharing a bed, or mosquito bites. None of those are risk factors. So HIV can be transmitted by sharing used needles, true or false? That's true. It's possible because blood is present, and there's also an activity introducing that blood into another person's bloodstream. HIV can be transmitted by sharing food or utensils. That's false. Even if there was a tiny amount of blood present, into the mouth is not really a great transmission entry route. There's an enzyme in saliva that partially deactivates HIV, so saliva is not a really hospitable environment for HIV to live. HIV can be transmitted through condomless sex. That's absolutely true. So depending on what fluids are involved, maybe there's semen or pre-cum, maybe there's vaginal fluid, maybe there's rectal fluid, or a combination thereof, and then exposure to a person's mucous membrane, or potentially to the bloodstream if there's tears in the lining of the rectum or the vagina. HIV can be transmitted that way. True or false, HIV can be transmitted by kissing. that is false. So we talked about saliva, how it's not a great place for HIV to survive, and also dry kissing, wet kissing, French kissing, whatever kind of kissing, as long as it's mouth kissing, is not a risk for HIV transmission. Here's some pictures of my family. There's my mom and dad. They met, fell in love, and got married and decided to start a family. And while they were trying, they found out that my dad was HIV positive. And he was a very optimistic person, so he decided that together they decided they still wanted to have a family. So they used a donor to get pregnant with me, and then 2 years later, my brother. And my dad hugged me and kissed me and changed my diaper, shared snacks with me, had naps with me, gave me baths, snuggled with me, and he and my mom hugged and kissed and shared a bed together until the day that they died. And my mom, my brother, and I are all HIV negative. And I share this with people so that if there's any lingering concerns around casual contact being a factor for HIV transmission, you can dismiss that absolutely. In fact, having relationships and intimacy and closeness with people who are living with HIV is a positive thing, because it means, one, that you understand the risks and what is and is not a risk for transmission, and two, it breaks down the stigma that's around people living with HIV and creates a sense of compassion where before there was fear and misunderstanding. In terms of prevention, there's good old abstinence, which is not necessarily realistic or desirable for everybody. That's why the list is a lot longer. But abstinence refers to when people make a decision to not have sex or to not use drugs or share needles. Mutual monogamy refers to when people make a decision and they're both happy about this decision that they're only going to sleep with one another or have sex with one another. And it's a specific conversation to make sure that monogamy is a right fit for those people too. Condoms are a barrier between one person's body and another person's body. So they prevent the exchange or the exposure from fluids to mucous membranes or to bloodstream. And in the first picture, there's what you probably recognize or think of when we say condoms. And in the lower picture is a picture of an insertive condom and is worn inside the vagina instead of on the penis. Dams, you might hear referred to as dental dams. This is not a picture of what they look like. This is what they look like. They are thin, very satiny, soft, rectangular sheets of latex. You can also get non-latex versions on Amazon. They're called hot dams, and they come in various scents. And they're meant as a barrier for oral sex done on somebody's vulva or butt. And they're a barrier because you can get certain STIs in your throat, like chlamydia, syphilis, and gonorrhea, as well. Cold sores are a form of herpes that can be transmitted from mouth to genitals as well. So that's a nice barrier. Sometimes people actually prefer them because they feel a little bit better. So that's just another option. Lube, not the kind of lubricant that you would put in a car, nothing oil-based. Instead, something water-based or silicone-based as a lube to be used with condoms. And lube is important because it makes things fun, slippery, and wet. Really, that's all there is to it. They make things feel good, and they reduce the bad kind of friction that could damage a condom or possibly result in tears to a person's mucous membrane. Routine testing, which is normalized testing, is that people have a good idea of what their risks are, and based on their level of risk are going to get tested every 3 months, every 6 months, or maybe annually every year, and that they're getting their partners tested too. And when it's routine testing, it's something that everybody does. So it's not weird if somebody goes for testing. It's not weird if somebody wants to get tested before they have sex with a new partner, or it's not weird if somebody asks their partner to get tested. That's what I mean by routine testing. Safer substance use is when somebody is going to be maybe using drugs or drinking and also having sex. So it's that combination of things where sometimes somebody's drunk or high and they won't make the same decisions that they would when they're sober because they're feeling invincible or it's not a priority. It's just not on their radar. So safer substance use looks like having a buddy, not using alone, using substances separately, so if you haven't mixed before, keeping track of your drinks, or bringing condoms and lube with you to a party. Needle syringe programs like Aqua offers allow people to pick up safer injection supplies and also safer inhalation supplies and bring back their used supplies so that we can dispose of them safely. Safer piercing and tattooing really just refers to going to a reputable artist, somebody who will show you how they clean up their workspace, put on gloves in front of you, throw out used equipment in front of you, and somebody who makes you feel comfortable asking and answering questions about your safety and the work that they're going to be doing. And ending stigma, because remember this, if we start having these conversations and everyone has the right information, people can make decisions that they're going to feel good about for themselves. HIV testing is a specific kind of testing that's done. At Aqua, we have a clinic running Thursdays from 4 to 7 p.m. So it's at our office in Kitchener. We have free and confidential testing. Anonymous testing is also available. And we have 2 types of tests that we offer. There's the rapid test, which is the finger prick. There's the standard test, which is drawn from a blood from a vein. Rapid test is about 2 minutes before somebody gets their results. Standard test, the results come back between 1 to 2 weeks. There's a window period before a test is accurate, and that's because the test is actually looking for the antibodies to HIV. So if somebody's infected, the antibodies will form in response to the infection, and they take about 3 weeks to 3 months to show up. So that the window period of 3 weeks to 3 months before a test is conclusive. And these are some pictures of what the clinic looks like. So a little alcohol swab, prick of the finger with the lancet, and the blood is mixed with a couple solutions into a little well. And based on those results, there will be either a reactive or non-reactive result, and the person will either do follow-up blood work or they'll have a conversation with the nurse about any other concerns or questions they have. They can take some condoms, and then they're bandaged up, and you're on your way. Disclosure is a difficult thing. It could be a whole workshop on its own. Right now, we don't really have the culture that allows for disclosure of HIV positive people. And that's where I'd like to see us get to. So in the meantime, if somebody who is HIV positive discloses to you, stay away from saying things like, how long do you have? Who gave it to you? And I'm not going to get it, am I? These things are really misinformed, and they're also not very supportive and super stigmatizing. Instead, saying things like, you're not alone. I'm here for you, and I appreciate you telling me that, because we don't know how many times before someone's disclosed their status to somebody and been met with rejection or humiliation. So being somebody who's supportive. So they're showing you that they trust you by disclosing their status to you. Show them that you're worthy of their trust. Some things to think about. About 1 in 5 people who are HIV positive are unaware that they're HIV positive, and this is a pretty high number. Now, there's some reasons for this. One, people don't really talk about HIV anymore, so they don't really have the information in terms of transmission and risk, so they might not think that anything they're doing is putting them at risk for HIV. 2, people sometimes think that this is something that happens to other people, so it's a distancing mechanism, right? That's something that happens to other people, not me, not people like me. And the truth is that HIV doesn't discriminate. Anybody can become infected, so getting tested is really important. Some people think that they'd know if they're HIV positive, that they'd feel different, but the only way to know is to get tested. And thirdly, some people are just in fear. There's so much stigma that's still attached to HIV that people are afraid to learn their status. And that's that's absolutely a real and legitimate fear. So we need to work on the stigma that exists. Also thinking about the narratives that exist around HIV, or the stories that people tell. So what kind of characters show up? Are there characters who are HIV positive in TV and in movies? And are they telling complex stories, or is it just the simple victim kind of narrative? Because people who are HIV positive are not dying helpless, sick, being punished, guilty, or dirty. They're just HIV positive. Their status does not define them. It's a part of who they are, but certainly not all of who they are. And to sum up, you don't have to whisper. It's okay to talk about HIV. You might even learn something. And that's really what I'm hoping for, that when we start the conversations, we break down the stigma that's around HIV, we can get accurate information, and people feel comfortable asking their questions. If you do have any questions, you can check out these resources. Katie.ca is the national resource for HIV and Hep C. Stigma Project is where all those awesome graphics in the presentation were from. And if you have questions for me, you can email me or use our anonymous text option. So the number's there. You just text us. It'll be myself or one of my coworkers answering. We won't ask any information that we don't need to know. We'll get you the information, the accurate, legitimate sexual health information that you need. And then if we don't hear from you again after a couple days, we'll just delete the thread and your number from our phone. So that's it. If you have any questions, I absolutely invite you to ask. And yeah, happy learning. Thank you.